Hello, today with this FERNE presentation we will be discussing the care of emergency department patients with dizziness and vertigo in an attempt to appropriately diagnose and treat patients with a potential serious central etiology. My name is Edward Sloan. I'm an emergency physician in Chicago. I work with FERNE, the Foundation for Education and Research in Neurological Emergencies, ferne.org. I have no financial conflicts. I'm the FERNE president and board chair. So let's consider dizziness and vertigo dictionary definitions. It's worthwhile to go to the dictionary so we can all have a common understanding of what lay people may consider to be dizziness and vertigo. So dizziness is an adjective. It is thought to be a whirling sensation, but also it is defined as mentally confused, which is altered mental status, which clearly is different than dizziness. Vertigo, a noun, has the same information, whirl dizzily, and it also includes confused. So not only is there overlap between dizziness and vertigo, but there's also some misinformation in the Common Merriam-Webster dictionary. So vertigo is found to include vertiginous movement, and we'll talk about that because movement is important. So what are the consensus definitions by experts who attempt to better understand the treatment of patients who present with dizziness and vertigo? We go to a publication by Jonathan Edlow and David Newman Tokar, and these two individuals have spent a great deal of time better understanding how the emergency physician or emergency provider can address adequately symptoms in patients who present with dizziness and vertigo. And in this publication, they give us what are consensus definitions developed by experts in the field. So we're going to start with pre-syncope or near syncope, which is faintness or the impending loss of consciousness. That is different than syncope, which is the transient loss of consciousness due to some amount of global cerebral hyperperfusion. It's relatively rapid in onset, of short duration, and it provides for a spontaneous complete recovery. It's often associated with loss of postural control. Patients need to be seated or they may actually fall down. So this is different than unsteadiness. Unsteadiness is the inability to stand or walk appropriately. The patient is unstable, and they often can experience this either while seated, standing, or walking. And the importance of determining unsteadiness is that if a patient walks down a hallway and literally is bouncing off the wall because they can't walk straight, this could be or represent cerebral ischemia. This is different than something they define as directional pulsion, which is also unstable, the tendency to veer or fall in a particular direction. And in other words, it means you appear to be unsteady in one direction. So directional pulsion is similar to unsteadiness in that it may suggest cerebral ischemia. I was once skiing in a whiteout with my daughter. We were on the top of the mountain at Snowbird. And when we stopped, our eyes continued to move because we could not focus on anything because literally we were in a cloud. And that feeling of veering to the side because your eyes are not correct or because there's some inability to register the environment around you is an important clinical sign. So now let's consider what is vertigo. How is it defined by the consensus group? Vertigo is the sensation of self-motion. So clearly vertigo, as opposed to dizziness, involves some sense of motion. That can be of the head or body when there's no real movement occurring. In other words, a slight movement of the head can cause the sensation that the body or head continues to move. So vertigo involves some sense of motion. This motion can be a sense of rotation, such as spinning or rocking, linear motion, falling downward, such as in an elevator, or some static tilt relative to gravity where the patient feels like they're moving and not standing up straight. So this movement can be rotational, linear, or have some tilt component to it. So that leaves us with dizziness. How is dizziness defined by the consensus group? Dizziness is the sensation of a disturbed or impaired spatial orientation. In other words, the patient looks out and they feel as though the environment around them doesn't seem right, that it seems to be abnormal. This is a false or distorted sense of motion, perhaps, but in general, most dizziness doesn't necessarily involve a sense of motion or vertigo. And with that, I say thank you. For any further information, I encourage you to go to FERNE.org, or we can go to the FERNE.org channel and subscribe on YouTube, or you can send us an email at FERNE.org@gmail.com. Thank you for your time and attention to this important clinical information related to the neurological emergency of acute vestibular syndrome in emergency department patients. I'm Edward Sloan. Again, thank you and have a good day.